Hi, my name is Erica Larson, and I'm a nursing instructor for the University of South Dakota. Today, I'm going to teach you a little bit about an activity that I like to use in my classroom. The activity is called Thin Thinking, T-H-I-N. So this activity can be used in theory, sim, in clinical and in-person clinical, or also in the lab. Anytime that you're presenting a student with a patient case. It can also be used, as I'll explain a little bit later, it can be used anytime the student is working through NCLEX style questions because we're putting the students at the patient bedside during those questions. So what this activity does is it helps them develop their clinical judgment part of their brain, which we know is hugely needed and hugely tested on within the NCLEX. Okay, now what I want you to do is grab 4 note cards. Preferably those note cards should be colored. The reason that I like to have my students use color is because it's a memory technique. It allows the students to make associations later on as they're working through things with patients. All right. On the note cards, I'm going to have you take 1 note card and I'm going to have you put a big T on it. And beside that, I want you to put top 3. Underneath that, put needs, concepts, and questions. I'll give you a second to do that. Okay. On the next note card, put an H, a large H on there, and then write help quick, act now. All right. Underneath that, you can put, or just put in the back of your mind, think about right now what is best for the patient. All right. On the 3rd note card, I want you to put a big I. On the note card beside that, put identify greatest risk or safety need. And then on the last note card, put an N, a large N. And beside that, put nursing process. And then underneath that, you want to have room for 2 words, assessment and implement. All right, let's go into what each of these note cards means. First, the T, top 3 needs, concepts, or questions. So every time you walk into a client room, you need to be thinking about what does this patient need right now. Every single time you walk into a client room or every single time you have a patient, a client in front of you. That's your T. Your H, help quick, act now. Is there something that needs to be done right now? Is there an action that needs to occur? So as you are walking into your client's room, as you are faced with an NCLEX style question, or as you're doing an unfolding case study, you got a client in front of you, you should be assessing for those urgent needs. All right, are there urgent needs that require you to act? And then I, identify greatest risk for safety. Again, every single time that you have a client in front of you, whether it is a case study or a live client, you have to be looking for those safety risks. And N, nursing process, assessment and implement. We can't forget to use the nursing process, and all 5 steps are important, but there are 2 that are the biggest heavy hitters, and that's assess and implement. Now, the reason that we know these are the biggest heavy hitters is because they're directly tied to that clinical judgment piece. And nurses, as they are walking into that client's room, as they are walking past the client's room, as they are looking at a client, they're assessing and implementing almost concurrently. They happen pretty much at the same time. And because of that, the NCSBN, the group that develops the NCLEX, they've got assessment and implement questions as a majority. Okay, so how do we use their note cards? They're meant to build habits in our thought processes. I have my students pull them out whenever they're in clinical, whenever they are doing a case study in my classroom. Whenever they're in sim, we have them pull them out to help build that thought process. In the classroom, when I'm doing case studies within theory, I will have the students pair up and work through the case study, and I have them pull those note cards out. And what I do is I walk around the classroom while they're doing that, and I ask them the individual questions, one question at a time for each pair, and then just kind of work through. And that allows me to identify, do they have specific weaknesses related to this content, to this case study? And that helps me determine, what do I need to lecture more on after they're done working on the case study. So again, using this activity helps us grow in our clinical judgment. Thank you for allowing me to tell you a little bit about thin thinking and how I use it within my classroom.